The takeoff is the most essential part of long jump technique, and a crucial phase for converting horizontal velocity to vertical velocity, and to project the body into the air. However, the takeoff can only be successful if its preparation is performed correctly, so that the loss of horizontal velocity is minimized. The takeoff motion of the long jump is performed at high speed and in a short time lasting about 120 milliseconds. The takeoff may be divided into 3 phases. The placement of the foot, an initial, or isometric phase, during which the angle of the knee joint remains practically unchanged. A middle phase, often described as eccentric, or amortizing, in which the knee joint angle decreases. And a final phase, the push-off phase, also described as concentric, in which the knee joint angle increases. There are 2 schools of thought concerning how the takeoff foot should be brought into contact with the ground in the long jump. The first advocates a so-called active landing, in which the foot is brought to the ground in a backward sweeping, or pawing movement, minimizing the loss in horizontal velocity experienced during the takeoff. The second school advocates a locking placement, in which the foot is neither moving forward nor backward relative to the center of gravity of the athlete at the instant of contact with the ground, facilitating the increase in the vertical velocity. In general, when planning the foot at takeoff, the initial contact should be flat-footed, with heel contact kept to a minimum. The action is kept on the ball, and the outer arch of the foot. To increase the duration of the foot contact, the athletes plant their foot ahead of the center of mass at touchdown. However, the resulting increase in vertical propulsive impulse is accompanied by an undesirable increase in horizontal braking impulse. Therefore, there is an optimum leg angle at touchdown which offers the best compromise between vertical propulsive impulse and horizontal braking impulse. In the long jump, the optimum takeoff technique is to run up as fast as possible, and plant the takeoff leg at about 60 to 65 degrees to the horizontal, and at a knee angle of 160 to 170 degrees. Just before touchdown, the athlete pretenses the muscles of the takeoff leg, from the muscles of the sole of the foot, up to the ischiocrural hip extensors. The subsequent bending of the leg during the takeoff is due to the force of landing, and is not a deliberate yielding of the ankle, the knee and the hip joints. Flexion of the takeoff leg is unavoidable. It ranges from 140 to 150 degrees, and is limited by the eccentric strength of the athlete's leg muscles. Why do long jumpers laterally lean at the touchdown of the takeoff foot? A study during the 2007 IAAF World Championships in Athletics in Osaka revealed that the leg angle formed by the hip and ankle in the frontal plane at the touchdown of the takeoff was -2.6 degrees for Saladino, -4.7 degrees for Howe, and -1.3 degrees for Phillips. This indicated that the top 3 jumpers slightly inclined the takeoff leg inward at the touchdown of the takeoff, and that jumpers placed their foot in the medial side. This results in a slight inward lean of the takeoff leg during the takeoff phase. During the takeoff in the long jump, the hip joint of the takeoff leg exerts large abduction torques. The functions of the hip abductors are to bear the body during the first phase, and to obtain the vertical center of gravity velocity effectively during the second phase. The lateral lean of the long jumpers observed at the touchdown of the takeoff induces the hip joint of the takeoff leg to exert the large hip abduction torque. This suggests that long jumpers may have to consider their strength training of the hip abductors to effectively utilize the benefit. An explosive extension movement of the joints, which is supported by a synchronous, energetic swinging and a sudden stopping of both the arms and the swing leg for impulse transmission, leads to the takeoff posture. The forward component of the vigorous arm and leg swing generates horizontal momentum. This helps the jumper to overcome the initial braking effect of foot strike and allows him to continue rotating over the takeoff foot. This phase of the takeoff is often called the propulsive phase. When the thigh of the swing leg and the upper arm of the swing arm are parallel to the ground, all swinging movements should be abruptly stopped or blocked. This blocking action is stressed during the takeoff drill because it aids in transferring momentum from the swinging segments to the rest of the body. The variations observed in analysis of the takeoffs of the world's best long jumpers can be divided into 4 categories. The first category is characterized by the double arm swing. Igor Turovanissian and Robert Emian from USSR have applied this arm swing technique. A direct relation to the hang style does not exist, even though it would be a sensible anticipation as far as the parallel arm action in the flight phase of this technique is concerned. The effectiveness of the double arm swing itself is beyond doubt. In the high jump, it is well established as part of the flop technique. Referring to impulse, which for the long jump takeoff should also be primarily vertical, the double arm swing would seem to be logically consistent. The reason for not choosing the double arm swing as an ideal typical model is that, from the point of view of coordination at highest speed, it is very difficult to switch smoothly from the normal sprint arm action during the cyclic run-up to the double arm swing. A second variation can be seen with all jumpers who apply the hitch kick technique, and anticipate the active forward kick of the lower part of the swing leg at the takeoff. This dynamic element is only possible through a premature release of the knee joint locking. In any case, this takeoff posture can only be attributed to those jumpers applying the hitch kick technique. A third category is the classical counter-arm swing. As far as flight technique is concerned, this figure is neutral. This means that the takeoff posture itself does not allow for any conclusions regarding the following movements. The fourth category is chosen as ideal typical. The erect posture of the trunk, the slightly elevated head, the high shoulder girdle, the horizontally locked and bent swing leg, and the completely extended takeoff leg, including the hip joint, are exemplary.